Joint pain can be caused by a variety of different things. There are actually quite a few different conditions that will result in pain around your joints. There are a number of different treatments available to help with joint pain, but they really all fall into two general categories: pain relievers and disease-modifying medication. Let's take a closer look at each of these categories to see how they treat joint pain. Disease-modifying medications are medications like Tylenol or ibuprofen which actually numb the pain from your joint pain by reducing the receptors in your brain that signal your body to feel pain. For many people, joint pain is caused by some type of autoimmune disorder. It's been determined this way because the symptoms are very similar to those of a real autoimmune disorder, and you can tell from the symptoms that something is out of balance. For others, like those with fibromyalgia or an overactive thyroid, joint pain is caused by something more basic. It could be something as simple as a lack of good nutrition, or it could be an infection like an infection in your joint. Either way, disease-modifying medications are very useful for treating the symptoms of fibromyalgia, like fatigue. Also, they are a great option if you're taking antibiotics and think you might have a moldy tooth that's causing bad breath. If you have joint pain, you should first make an appointment with your family doctor to determine what kind of disease has caused it, and to find out if there's an underlying physical problem that's causing it, like rheumatoid arthritis or osteoarthritis. Your doctor will run some tests, like blood work or X-rays, to see if you have any of a number of conditions that can cause joint pain. If there is a diagnosis of rheumatoid arthritis or osteoarthritis in both of your joints, you'll likely be put on an estrogen or progestin medication. A woman's body produces a specific protein called estrogen, which plays an important part in controlling the inflammation that can lead to joint pain and stiffness. If you have reactive arthritis, the estrogen level is too high and affects the cartilage and connective tissues in your body. Women with reactive arthritis may experience swelling, hotness, and stiffness of their joints. While this condition usually disappears after menopause, it can cause serious problems in pregnancy and can even lead to the formation of kidney stones. There are a number of other conditions that can mimic the symptoms of arthritis, including pseudogout. Pseudogout is a painful fluid-filled softening of the cartilage found in the joint cavity. The pseudogout diagnosis can be quite difficult because not all patients with it show the same symptoms, so your doctor may have trouble making a correct diagnosis. Pseudogout is usually diagnosed by X-rays or by MRIs, magnetic resonance imaging, scan. Blood tests are also necessary to confirm the diagnosis of pseudogout. Many people have symptoms of arthritis that do not involve their joints at all. These can be symptoms of many other conditions. These conditions can manifest through various symptoms such as swelling, redness, itching, hotness, and even inflammation or a rash. You should make note that joint pain may be present along with any or all of these other symptoms, so make an appointment with your doctor if you have any of these symptoms. If you are experiencing pain in your knees or ankles, don't ignore it. Your doctor may advise you to see about getting a joint replacement. This is most commonly done if your knee or ankle requires surgery or if the joint has lost its ability to function properly. A knee replacement will restore full mobility to the joint and will prevent the onset of knee or ankle joint pain again. The procedure for a knee replacement is actually quite simple and a great deal of your comfort is taken care of at this point. One of the more serious types of this condition involves an infection that affects one joint on one set of bones in your body, leaving you prone to infection throughout your entire body. Joint pain accompanying gout can be very intense and debilitating, so make sure you take it seriously. Your doctor may recommend an MRI to look at the inside of your body, but more often than not, a gout flare-up will be found as well. Gout is one of the most painful types of this condition and can cause significant damage to your kidneys and to your joints if left untreated. If you suspect that you have gout or another type of inflammatory arthritis, you should see your doctor right away to get a correct diagnosis and start treating it. Joint pain symptoms. Joint pain usually increases with age, although some conditions may contribute to painful joints even in childhood. Various diseases and conditions can cause joint pain, such as rheumatoid arthritis, osteoarthritis, tennis elbow and bursitis. The symptoms may vary depending on the condition. Some common joint conditions are described below. Cartilages and synovial fluid. Cartilages, or the connective tissues that hold bones in place, contain lubricating substances called synovial fluid. When there is inflammation in the joints, the cartilages swell and can produce severe pain and stiffness. Synovial fluid contains proteins, fats, sugars and other nutrients that help the cartilage to maintain its elasticity and cushion it from friction. Rheumatoids and bursitis. Rheumatoids affect the large joints of the body, while bursitis affects the small joints. Both cause joint pain treatment according to how they affect the joints. Rheumatoids cause pain around the site of inflammation, while bursitis produces inflammation around the joints. Diet rich in antioxidants. Vitamins C and E are anti-inflammatory and analgesic, which may help relieve joint pain from a condition like osteoarthritis, which is caused by inflammation of the cartilage. A diet rich in vitamins C and E may prevent damage to the joints caused by free radicals and other toxins, which are also found in cigarette smoke. In some cases, doctors treat patients with nutritional supplements, including those rich in vitamins C and E, to strengthen the cartilage and reduce the risk of arthritis. Radon therapy. A therapy using a radioactive substance called radon has been shown to reduce pain from arthritic pain, without adding to the patient's dose of pain medications. Radon therapy works by blocking the formation of chemicals called prostaglandins in the lining of the bones, which are involved in the inflammatory process. These treatments may work for some people, but not all. For example, some of these conditions can be chronic conditions, meaning that the body can build up a resistance to medications over time. Other diseases may have similar symptoms, and the only difference is the level or type of treatment needed. Therefore, it's important to talk to your doctor about your acute joint pain and get a complete diagnosis before you decide on a course of treatment for your chronic condition. For more on treatments for joint pain, see the link below.